Thank you. We may all seated. Thank you very much, honorable members. We are proceeding with our work. And a reminder of the business of the House, the Secretary shall then read the 7 order of the day.
Order number 7, Policy and Budget Speech on Vote 10, Department of Health.
I now call upon the Honorable MEC for Health, Honorable S.J. Manzini, to deliver the policy and the budget speech.
Honorable Speaker,
Honorable MEC, you may take a seat.
take a seat, MEC. Honorable Speaker, according to the rules of the House, we are not allowed to wear a hat, especially males. So I hereby request former Honorable Van Fool to address the hat through you. Thank you.
Thank you very much. Honorable Sidibe, guests are allowed as invited. Even the Mahoshi, they are allowed to wear their traditions according to the manner in which they feel fit. And I strongly believe that you said it in a lighter note. It's okay. I understand. For the break, it's okay. We may proceed, Honorable MEC.
Honorable Speaker.
Honorable MEC, may take a seat.
Honorable Speaker, I'm just raising the concern here in the House. We have said the audience are not supposed to participate to the debate. Are they supposed to participate by clapping their hands and say Bogoto and stuff like that?
Okay. Honorable members. Yeah, honorable members, let me address one thing. You know, the rules give provisions that we have invited guests. Not unless we are saying these guests, they should no longer come here. And the rules give them a right to be here. Now, the rules give a provision that they should not participate. I don't think when we are all saying happy birthday, they should not say happy birthday. I'm making an example. They are human beings echoing what we are doing. But members of the audience, you are requested not to participate during the session, and you are requested not to converse loud, because the proceeding is for members to proceed with the work of the legislature. I hope that it's understood. Thank you very much, Honorable MEC.
Yeah, but they can clap hands. No?
They can clap hands.
Yeah.
Thank you. Okay. Honorable MEC, may proceed.
Thank you, Honorable Deputy Speaker of the Mpumalanga Provincial Legislature, the Honorable Premier of the province, Honorable Mandla Ndlovu, members of the Executive Council and members of the Provincial Legislature, the Provincial Secretary of the People's Movement, Comrade Mozichira, Chairperson of the Portfolio Committee, Honorable Munene Mhlongo, and members of the Portfolio Committee, representatives of the House of Traditional and Khoisan leaders, executive mayors, MMC councillors, and leaders from our municipality, the head of the department, Dr. L.K. Ndlovu, and heads of other provincial departments, hospital board, mental health review boards, traditional health practitioners, and our social partners, organized labor, development partners, civil society, faith-based organization, abafundisi, and the private sector. Managers and health workers and officials of the Department of Health. Deputy Speaker, there was a concern here because they see beautiful officials from the department. Ngizwa namhla bayanyakaza, hleze afika amaphoyisa namhla namngenile namanesi wami nama-EMS ngiyabezwa bomashilo bavuka umoya ngabatshela ngathi laba bominijere, there's no disruption in terms of services in our clinics. Akusiyiwo laba yenza umsebenzi laba managers in the department, just that they are in a uniform namhlanje, Honorable Deputy Speaker. And the people of Mpumalanga, distinguished guests, ladies and gentlemen, Honorable Deputy Speaker, I also rise to table the budget and policies speech vote 10 for the Mpumalanga Department of Health for the 2026-27 financial year. And I do so with humility, a deep sense of accountability, and with appreciation for the trust placed in the department by the 5.1 million people of Mpumalanga whose lives or that of their relative depend on. Today I stand before you inspired by the wise words of the former president, Nelson Mandela, who taught us, open quote, that what counts in life is not the mere fact that we have lived, it is what difference we have made to the lives of others, close quote. And the young mayor of the New York, Zoran Momdai, who called on all of us who occupy public office to govern expansively and audaciously, and said, we should always appreciate that, open quote, we may not always succeed, but never should we be accused of lacking the courage to try, close quote. Owing to those words of wisdom, the true measure of this budget and policy speech is not found in the billion of rands allocated through this budget, but rather in the impact it will make on the lives of those who depend on our public health care system. This budget and policy speech can only be worth the paper it is written on if it improves the quality of healthcare services we provide and restores dignity to the people of Mbejega, Mgobotsi, Machipe, Velferdin, and many other parts of our province. We refuse to lack the courage to try and make a difference because we know very well that health is not only a service delivered in a clinic, a hospital ward, or an ambulance. Health is the foundation on which our people build families, attend schools, work, grow the economy, and live with dignity. A budget for health is therefore a budget for life, for equality, for productivity, and for the future of our province to strive. The economic fortunes of the province, especially the bold economic growth targets articulated by Premier Mandla Ndlovu in the medium-term development plan, depend on the health of the population of the province and the work our department is doing. This relationship between population of the province and the work of our department is doing. This relationship of access to quality health care and economic performance was recently properly articulated by the Momentum Health Chief Marketing Officer, Damian Mekho, who made the point that treating access to healthcare as a luxury for top earners is economically unsustainable. Because when an employee does not have timely access to quality healthcare, the impact extends beyond them and their families, but to presence and productivity in the economy. Statistics before the country inform us that absenteeism owing to health-related reasons cost the economy billions annually, so it is very important to have a Department of Health that functions optimally. That is why the Premier of the province, Honorable Mandla Ndlovu, and many other premiers of Mpumalanga who have preceded him have worked tirelessly to disrupt the pre-1994 health landscape in the province, which was characterized by deep inequality of access to healthcare and fragmented health system that denied millions of South Africans the right to adequate health services. Umalilanga lipuma empumalanga. Every day we wake up to undermine apartheid legacy in the health sector by building new health facilities, buying new ambulances, and increasing our services offering. It is worth noting that we do this work and present this budget under a very difficult fiscal condition in the country, where the state revenue to fund social policy, especially education and health, has been on a constant decline owing to the low economic growth. These rising costs of living also affect the provision of public health care, as those who were medically insured abandoned medical aids to finance other competing needs, and as a result rely on the public health system, which is already overburdened as it is caters for 90% of the population without medical aid. The budget we present today is therefore not merely a financial statement, but rather a declaration of our commitment to build a healthier, more resilient, and more prosperous Mpumalanga. It is commitment to ensure that every child receives quality health care, every young person has access to preventative and curative services, and every woman receives dignified maternal care, and every community benefits from the responsive and compatible public health system. The overriding principle of this budget is to stretch the rent as far as we can and do more with as little more as it is practically possible. This budget is committed to eradicating any form of financial leakage and wastage in the provincial system, and this we will demonstrate when we unpack the efficiency projects we are implementing as a department. And one of those impactful efficiency projects we are currently implementing is the insourcing of core function of the department, which does not reduce financial wastage, but also contribute to sustainable job creation. The Mpumalanga Department of Health was among the first to insource cleaning services in our facilities, after it had already insourced the administering of kitchen services where they were privatized. We are in the process of insourcing key tertiary services, such as dialysis, as we have already done in Rob Ferrer, and this is already saving the department millions of rands. We are also doing our best to reduce reliance on service providers for maintenance of our infrastructure, as we have established maintenance hubs in our district, which do elementary maintenance work, which was allocated to service providers in the past. And for this project alone, we have hired 25 artisans, 97 apprenticeships in the previous financial year. So as a department, we are committed to the project of creating sustainable jobs and saving money for the department through insourcing of core services where it is financially and viable and practically doable. Very important, because we can't insource everything. Honorable Deputy Speaker, we can do some of this work with extremely limited resources because our workers, who are in many instances go beyond the call of duty or their prescribed job description to deliver quality health care. Amongst those encouraging stories of exceptional work and going beyond the call of duty is the story of Dr. Rabutla, a pediatrician surgeon who led a team that successfully operated a child with gastroschisis, a birth defect where babies are born with intestines on other organs which are developed outside the abdomen. The story of Dr. P.D. Maubele was led by a team that successfully operated a child born with corneal atresia, a rare medical condition where the back of the nasal passage is blocked by a bone or soft tissue, causing severe respiratory distress immediately after birth. Dr. Mayobela is here as I request him to stand up for the good work that he has done. Through you, Honorable Deputy Speaker. Honorable Deputy Speaker, in the past, these are medical procedures that will rely on Steve Biko Academic Hospital to perform for us, but we are now able to do them in our own facility here in Mpumalanga. Honorable Deputy Speaker, at the moment when HIV and AIDS threaten the very fabric of our society, the founding father of our democracy, President Nelson Mandela, challenged leaders, scientists, and communities to place human lives above division and debate. His intervention helped shape a stronger national commitment to the fight against HIV and AIDS and inspired a generation of healthcare workers and activists to continue the struggle for health justice and an HIV-free generation. I'm certain we all remember the call he made at an international AIDS conference in Durban in 2000 when he called for unity in confronting one of the greatest public health crises of our time. As a direct response to this noble call, a lot of work has been done, happening and also in the struggle to construct an HIV-free society. And we are proud to report to the August House that our country now administers lenacapavir, HIV prevention medicine. The launch of lenacapavir, which is a preventative medicine, not a vaccine, and is considered as one of the most exciting HIV prevention advances in years, happened here in Mpumalanga, as the Premier said, on the 5th of June, 2026. The Mpumalanga Department of Health will use 31 sites identified by the National Department of Health to administer phase 1 of the medicine. And we are encouraged by the loud outcry from communities I've seen on social media, from Kangala, from Chifalbetli Tuli, from Bushbuck Ridge, and all parts of the province who are demanding sites in their communities. And as this clearly demonstrates our people's commitment to taking all forms of preventative measures to build an HIV-free society. We want to assure them that as more stock and resources become available, more sites will be established to administer these important preventative measures. Owing to the limited resources and considering that phase 1 is largely financed by the donation from the Global Fund, the National Department of Health had to prioritize provinces and districts, meaning that it was not even all provinces and not all districts, with the highest number of HIV and AIDS burden. And facilities whose service is the largest number of targeted groups. The targeted groups who are most vulnerable to new infection include HIV-negative pregnant women, young girls between the age of 15 and 24, and all other designated groups. We call on all the people of Mpumalanga to take this preventative medicine, especially young girls between the age of 15 and 24, as they experience the highest HIV infection. An HIV-free generation is possible, and it begins with me and you taking lenacapavir. I thought it was important that I give this elaboration opening argument to make it easy for this House and the people of Mpumalanga to understand why we are pleading not guilty for lacking the courage to try to make a difference in the lives of our people and others as we dive deep into the 2026-27 financial year budget and policy speech. Honorable Deputy Speaker, I stand in front of the people of Mpumalanga and the August House to plead not guilty for failing to try and make it the difference in lives of our people. Like also Mam Dani said that we may not always succeed, but never should we be accused of lacking the courage to try. So at this point, permit me to provide evidence of our effort to build a responsive, community-centered and accountable health system for a healthier Mpumalanga in the 2025-26 financial year. The principle of accountability requires that we return to this August House not only with new plans, but also with an honest account of what has been achieved in the commitments we made in the previous budget and policy speech, and what still require our attention. In the previous period, we committed ourselves to strengthening primary health care, improving emergency medical services, increasing medicine availability, strengthening maternal and child health, responding to HIV, TB, malaria, and non-communicable disease, expanding specialized services, investing in health infrastructure, filling critical posts, and improving governance. The department continues to implement prudent financial management and as a result maintain an unqualified audit opinion, increase the revenue it collects, and has been experiencing a decrease in accruals for the past 3 financial years. This gives us a platform on which to intensify our journey towards cleaner administration and financially sound Mpumalanga Department of Health. We are however not complacent. We continue to address the regular expenditure incurred because of the past contract and continuously strengthen our internal control to eliminate new cases or unwanted expenditure. On quality of care, primary healthcare facilities achieved a 100% patient experience of care survey rate. Cleanliness in our PSC facility improved to 87% against the target of 80%, and waiting time scored 91% against the target of 80%. Patient safety incident case closure reached 100%, while 98% of severity assessment code 1 incident were reported within 24 hours. We remain committed to ensuring that our health facilities are ready for the implementation of the National Health Insurance in 2025-26 financial year, where we can report that 285 of the 290 primary health care facility, which is 98.2%, achieved ideal clinic status. The 5 facilities that did not achieve this status were not assessed due to construction activities or temporary closure. In addition, all district hospitals achieved ideal hospital status. This demonstrates significant progress in improving quality, strengthening patient experience, and advancing universal health coverage. On human resource, the department continues to strengthen frontline capacity. In 2025-26 financial year, the department reported 21,679 filled posts against 23,883 posts, giving a vacancy rate of 5.2%. We exceeded the annual target for healthcare personnel employed, appointing 15,875 employees against a target of 14,122. This included 179 doctors against the target of 36, and 496 nurses against the target of 130. Women in the province, in the Department of Health, occupied 52% of the senior management service position. Youth appointment reached 35%, and 21 people with disability were appointed. We acknowledge that disability representation remains below the national target and will be addressed through funded appointment in this budget. On emergency medical services, our people told us that ambulances' response time must improve. The department improved priority 1 response performance to 75% in urban areas within 30 minutes and 81% in rural areas within 60 minutes. This progress was supported by closer monitoring of calls and response time, and it will be reinforced through improved dispatch, fleet availability, training, and staffing. On malaria control, we strengthen indoor residual spraying, surveillance and prevention intervention in malaria academic and endemic areas. And as a result, the province achieved a malaria case fatality rate of 0.4% in the 25-26 financial, meeting the target of below 0.5. This proves that prevention, early detection, effective surveillance, and timely treatment save lives. The department continues to confront HIV and TB, focusing on achieving 95-95-95 HIV target and ending TB by 2030. Mpumalanga has made noticeable progress in the first 95, and today 96% of people living with HIV know their status. 86% of them are on antiretroviral treatment, signaling a 2% improvement, and 96% of those on treatment are viral suppressed. These figures confirm that testing, treatment, and adherence save lives. We must, however, close the gap in the second 95. Hence, the minister launched a campaign of closing the gap, meaning that everyone must assist us as a department to make sure that we trace these people and we are able to make sure that 95% of them does take their treatment. And it might happen that they are here. If you know yourself, you have tested and you were positive, you didn't collect your medication, go to your nearest clinic and collect medication. If you started collecting medication and you stopped, you must go and collect your medication so that we reach the second 95%. We are also addressing lower HIV testing among men and young people aged 15 and 24. The department will strengthen targeted testing, prevention, education, treatment, literacy, PrEP access, and differentiated care. In line with national prevention innovation, long-acting prevention options such as lenacapavir will be supported where guided by national policy and implementation framework. Our TB treatment success rate for the MDR-TB and pre-XDR-TB is at 80.6% and 72% respectively. This shows that when people test early, start treatment early and remain in care, TB can be cured. We will continue to end TB campaign to encourage early testing and treatment initiative and adherence. With regard to maternal, neonatal, and child health, these remain one of our highest priorities during the year under review. Antenatal first visit before 20 weeks reached 78.9% against the target of 78%. Postnatal visits within 6 days of delivery achieved 89.1% against the target of 83%. And cervical cancer screening reached 68.6% against a target of 58%. These achievements mean that more women are accessing care early, more mothers and newborn are receiving critical follow-up and after delivery, and the way women are being screened for cervical cancer, which is very important because if we screen early, it means that you're not even going to go to the next care in terms of treatment. However, we remain concerned about outcome that directly affected the lives of mothers and children. The maternal mortality ratio stood at 123.4 per 100,000 live birth against a target of 106. A significant proportion of this death are linked to hypertensive disorders of pregnancy, which remain a leading clinical challenge. This condition places mothers at high risk and contribute to preterm deliveries, which in turn drive neonatal deaths. This is a reflection of a neonatal death rate of 14.4 per thousand live births, which remain above the target of less than 10.5 under 5 mortality reached, and 1.9% against the target of 1.1%. So immunization coverage, including the measles second dose and vitamin A supplementation, also fell below target, partly due to national vaccine stockouts. These challenges require decisive clinical leadership, stronger outreach, reliable supply, and closer support to facilities. On training, the department exceeded its target on strengthening clinical skill. We trained 4,277 health workers on critical skills against 3,000 target, awarded 70 first-year nursing bursaries against the target of 70, and trained 946 frontline workers. On health infrastructure, we must indicate that despite delays in some major projects, the new Middleburg Hospital, now called King Nyabela District Hospital, and Troya Clinic have been completed and operationalized. The department completed phase 3B of the Mapulaneng Hospital, renovation and digitalization of X-ray services at Caroline, Tenswalo, Benny Samuel, and Witbank TB Hospital are also underway. Further projects including Dumfries Clinic, Alexandra, Langkloof, Vezubuhle, Kinrose, and Witbank Mental Ward are planned for commission in the second quarter. Upgrading of Siabuswa CAC and Kwamhlanga Maternity Ward is in progress, while remaining projects are being accelerated. Honorable Deputy Speaker, this progress report shows that the department has advanced on many commitments. It also shows where we must do better, and we will not hide shortcomings. We'll address them through clear target, stronger district support, improved procurement planning, better contract management, reliable data, and accountability leadership. In terms of the 2026-27 annual performance plan, placed the department on a practical path of improved quality access, efficiency, and accountability. Our priorities are organized around clear service delivery commitment that respond to the needs of household, communities, and patients across the province. As we prepare for the national health insurance, the department remains focused on strengthening the foundation of the high-quality, people-centered health system. This means facilities that comply with standard, health workers who are supported, patients who are properly registered, and clinical information system that help us make faster and better decisions. Through the Ideal Clinic Realization and Maintenance Program and the Ideal Hospital Framework supported by Office of the Health Standard Compliance Assessment, we are continuing to build a culture of safety, quality, accountability, district clinical specialist team. We continue to provide clinical governance and quality improvement support. A key pillar of the NHI readiness is digital transformation. The department will strengthen patient registration system so that every user is uniquely identified and properly linked to care. We will also expand electronic medical record system to improve continuity of care, support real-time decision-making, and strengthen health data and planning. In the 26-27 financial year, we will sustain 100% patient experience of care rate in the primary health care. The regional specialized hospital will maintain full compliance. The NHI grant will support the constructing of critical human resource required for service delivery readiness. Honorable Deputy Speaker, a strong health system begins in the household and in the community. The department will strengthen primary health care services at household level through ward-based primary health outreach teams by piloting a digitalization of community health workers' services in Kangal. An investment of 1.1 million has been made towards the procurement of 1.5 tablets and data connectivity. This will enable community healthcare workers to digitally record households, serve and service rendered, improving accountability planning, service delivery, and 2 million has been allocated for blood pressure and blood glucose monitoring equipment to strengthen early detection of hypertension and diabetes to community level, and 3,000 community healthcare workers will be trained in the key healthcare competencies, and while 1.120 newly appointed community healthcare workers will receive uniform to enhance their visibility. This investment will strengthen community-based healthcare, improve access to essential services, and bring us closer to universal health coverage. Honorable Deputy Speaker, maternal and neonatal death are not merely statistics Each loss represents a family deeply affected and a life that should have been protected. Our response in the 2026-27 financial year is therefore focused on clinical and action orientation. We aim to reduce the in-facility maternal mortality ratio to 120 per 100,000 live birth, the neonatal death rate to 12.5 per 1,000 live birth, and under 5 mortality to 1.7%. These are not just performance indicators, they are steps towards the aspiration of the National Development Plan and the Sustainable Development Goals. To achieve this, the department will undertake province-wide clinical skills audit and quality assessment to strengthen care. Of facility level, we will implement integrated maternal and neonatal health training in the sub-district, capacitated at least 30 clinicians through advanced obstetric and maternal health training. We'll also strengthen low-risk delivery services of 3 pilot community health centers, Siposensimbi, Embalenhle, and Nelspruit. In addition, we'll equip 10 hospitals with high-care maternal and neonatal equipment, appoint 4 medical specialists, and deploy 15 Bakis vehicles for district clinical specialist team to improve outreach. Improving immunization in the 26-27, we aim to achieve 87% for children under 1 year and 87% coverage for measles, rubella second dose. Women's health will be strengthened through sustainable cervical cancer screening and improve antenatal books before 20. And we are going to make sure that we continue the school health program in terms of making sure that nurses are appointed to cover 31,770 grade R learners. The burden of disease in Mpumalanga requires a sustainable response to communicable disease, non-communicable disease, injured, trauma, and mental health condition. Under the district health program grant, 2.724 billion, the department will expand HIV/TB community outreach intervention. The annual performance plan target 1,438,672 HIV tests, 100,056 medical male circumcision, 48,896 PrEP starts, and 24,872 ART clients initiated on treatment, and 653,794 ART clients remaining in care. To improve retention and virus suppression, we will scale to universal test, treat, appropriate, and make sure that we close the gap of the campaign. For TB, the department targeted 389,370 TB NAT tests, 9,500 drug-sensitive TB treatment, start for client age 5 years and older, and also 350 drug-sensitive TB treatment. For malaria, the target remains a case fatality rate below 0.5 and will strengthen indoor residual spraying. The COVID-19 pandemic taught us that the preparedness is not optional. The province has therefore established and activated a fully equipped public health emergency operations center at Mombela Square. This center will serve as a command, control, and coordination hub for diseases outbreak and public health emergencies. Mental health will receive an increase in the 26-27 financial year. The department will strengthen community-based mental health services. As I always said, all of us, we are one way or the other, have a mental problem. It differs on the level where we are. The sooner we start treatment, treatment is different. Last stage, the treatment is severe. So all of us, we must look out in terms of what level are we in terms of the mental health problem. For non-communicable diseases, the department will strengthen prevention screening and outreach ward-based program. We are encouraged by the life expectancy in Mpumalanga, Deputy Chair. It has increased to 64 years for men. Men was a problem, but at least we are seeing an increase in terms of men. Now they're at 64, they were at 50-something. And we are happy that men now at 64, because women are at 68.6 years, meaning that before 2030, women will be at 70, will have reached our target. But we are not going to reach our target because of men who are still at 64. So please, today the Honorable Premier is here, must assist me to lead all men. Go to your nearest clinics, check impilo. Because when you look at the hospital, because clinic for 30 years. Mara umama uphethwe inhloko uye clinic. That's why it's treated early. So Premier assist us to lead abobaba from 64 years to 68 years before 2030. So, Honorable Deputy Speaker, in an emergency time in medicine, emergency medical services must therefore be reliable, properly staffed, well-equipped, and responsive to both urban and rural. And a total of 32 EMS practitioners were appointed and assumed duty by the 1st of June 2026. Honorable members, last time Honorable Tom wakhuluma ngema EPWP bafuna kumphikisa. So I hope you are not going to go against me when I'm saying we have appointed 32 EMS practitioners were appointed, and additional 32 posts will be advertised in the second quarter, and this will improve dispatch, fleet management, and training disappointed or EMS personnel. We remain on course to expand tertiary services, and we are saying that in the province, patients do not have to travel unnecessary far to access complex care. Specialized services must not be privileged of geography. They must be accessible for the people of Mpumalanga. We can indicate that renal dialysis services in the province were previously outsourced, as I said, to private sector, and the department did not have adequate capacity to render dialysis services, but the cost of outsourced dialysis service of the two tertiary services was costing us 29 million per financial year per hospital, which was unsustainable and continued to increase. The department therefore took a strategic decision to insource dialysis services, build public sector capacity. Rob Ferreira commenced the takeover of dialysis patients from April 2025 and April 2026. A total of 89 chronic patients have been taken over from April 2025 to May 2026. The unit conducted 12,755 dialysis sessions. And what is also good, because every time you insource or you provide services in our public health sector, you are told people will die. Standing here, I can tell you that in terms of the dialysis services, since it has started last year, April, there's zero mortality recorded. So we are providing that service in-house in Roferel. This is notable achievement, and the unit provided a 24-hour service, has 24 dialysis machines and chairs, and is supported by a fixed reverse osmosis plant with capacity to dialyze 18 to 20 patients per session per day. On the 23rd of April, we officially launched the dialysis in Roferel. Witbank Hospital will take over outsourced patient also. Now we are moving to Witbank Hospital around Kangala district using the same approach. The hospital is already providing acute dialysis in-house as preparation for the takeover process. To cater for patients in Karsibande also, who are currently dialyzed by the service provider, plans to establish a satellite center at MLO Hospital are underway. Procurement of medical equipment and appointment of staff for MLO satellite services have commenced, meaning that now we will have our own centers in each district, Roferere, Witbank, and ML. And also when I was discussing with the specialists, they were saying that as we move forward, they can also open other one in our regional hospital, which is Mapulaneng. We can look at Shongwe. We can look at making sure that our people does not travel long hours to go, even if it's within the province. The dental laboratory project in Witbank Hospital is nearing completion and will be operationalized during the second quarter of this financial year. It will be the first dental laboratory in the province and will serve patients across Mpumalanga. Consumables for the dental for 200 patients have already been secured. Rob Ferreira has also established a pediatric cardiology unit, which is already admitting and managing children with heart condition for the first time in the province, across the province. The unit is led by one of our own doctors. You know, when we say we don't talk about stories, we took our own doctor to go and specialize. Now she's back. She's now working in Roferera, and she has commenced the establishment of the catheterization laboratory at Roferera. I don't know whether she's here because we said she must come so that we can also showcase one of our doctors. She's one of our own where we took. Thank you very much. Thank you very much. So the department had also taken a decision. Thank you, Deputy Speaker. The department has also taken a decision to renovate and digitalize X-ray department in health facilities. This phase approach replaces analog X-rays with digital system, aligned with our effort to provide modern diagnostic equipment. To date, 21 facilities has been digitalized in the province. And now we are moving towards including Dinzwalo, Benny Samuel, Caroline, and Witbank TB in this financial year. In this financial year, department plans to digitalize Piet Retief, Standerton, Impungwe, with the remaining facilities to follow. We want to make sure that all our hospital in the province does have the digital X-ray. Health services are also changing lives. During the past financial year, 8,413 learners received eye tests and 1,597 were provided with spectacle. In addition, 20,760 people were screened for eye problem and 7,596 received spectacles. And the department also performed 2,452 cataract operations, restoring sight and independent to many residents. And 2 of those ones, eyesight was restored, are here with us. And I was happy because I met the 2 outside. They are walking. They are here. To you, Deputy Speaker. Ubaba Obed Sengwayo, no Mama Esther Ngubeni. They are walking from there, coming inside here. So they are here. Umama no Baba. Bangasukuma sibabone sibashayela izandla. Yeah, ngibabonile nami bazihambela bebangaboni manje sebayahamba baze nase-legislator namhla because of the good work that the department is doing. The cataract surgery backlog has been virtually eliminated in parts of Ehlanzeni district, particularly Etonga and Shonga Hospital. The Honorable Deputy Speaker, no health system can function without reliable medicine, medical supplier, diagnostic and support services. The department continues to monitor medicine availability in our facility to ensure that patients receive treatment they need. And we can confirm that in the province, our medication supply is always available, and as we monitor it also. Healthcare is delivered by people, our doctors, nurses, pharmacists, and in the department will train 4,000 critical skills and 300 frontline workers and 250. In terms of shortage of specialists and specialized skill, with the department will train 30 nurses in priority areas. In addition, 20 medical doctors will be supported through register so that when they come back, they become like a doctor who came back and become the first cardiologist in Mpumalanga. The statutory human resource training grant will support training, and an amount of 10 million has been allocated for the appointment of person with disability so that we push our percentage and meet our target. And we are going to make sure that we have allocated upgrade of our primary health care, your Etando Kukanya, Kinrose Clinic, Langkloof, Lebogang, Lefisukwane, Troya, because as we build, we must put more staff. So we want to appreciate Honorable Brimas. When you come and say we are building clinics, you also support us in terms of making sure that there are human resource to operate, because we can't build without officials that are there. So there is budget put aside for that. And also we are going to establish eye clinic in King Nyabela Hospital. And also we are going to make sure that we strengthen ICU high care services and further allocated 19.11 million to increase critical beds of maternal, pediatric and neonatal care in MLA Hospital and 2.2 strengthen neonatal in Standerton. To respond to the growing needs of mental health, we have put 15 million has been allocated to appoint staff to improve mental health, and 5 million to train specialists, and also 35 EMS healthcare workers. Honorable Deputy Speaker, infrastructure is direct determinant of quality. In terms of the department to ensure that life-saving equipment, because as you buy equipment, you must also service. Furthermore, 18 facilities, including primary care centers and hospitals, will undergo refurbishment and allocation of 212 million for maintenance. And this represents 12% of the total infrastructure, which is much higher than the 5%. So it means as a department, we have put money for maintenance, which is 12%. The department will complete 3 infrastructure in this financial year, which is the Mapulaneng Phase 3C, which is also including Siabuswa, CHC, Wheatbank Hospital Maternity Ward, Kwamhlanga Hospital Maternity Ward, Matikwane Hospital Maternity, Pediatric Phases, Langkloof, Alexandra, Lebogang, Lefiswane, Babaton, Vezubuhle, Kinrose, MN Timbi, and Dumfries Clinic. New primary health care facility targeted for this financial year is Lefiswane, Lebogang, Dumfries, and Troya, and the King Nyabela platform will continue to be strengthened with the relocation of service from the former Middleburg. The department will also construct new clinics, Malapo Mugale, Hlazache 3, Majembeni, and the old Middleburg Hospital Gate Clinic. As the public entrusts us to resource meant to save lives, Honorable Deputy Speaker, the Department of Health will continue to strengthen governance and is pleased to report that in terms of 2024-25, we got an unqualified, and we will continue to make sure that we improve the Auditor General. And what is good is that, Honorable Deputy Speaker, as a Department of Health, we pay service provider within 14 days. Comfortable within the 30 days required prescribed by the PFMA. And in the revenue grew from 15 to 4.4%, and the department in addition strengthened financial compliance. Honorable Deputy Speaker, in 2026 budget for vote 10 amount to 21,193,365 and is allocated as follows. Program 1, which is administration, an amount of 436,328,000 is allocated for this financial year. Program 2, which is district health services, we have put 12,783,142,000. Program 3, emergency medical service, we have put 589,810,000. Program 4, which is provincial hospital service, we have put 2,160,014,000. Program 5, which is central hospital service, we have put 2,406,457,000. Program 6, which is health science and training, we have put 617,515,000. Program 7, which is healthcare support service, we have allocated 425,824,000. And the last one is Program 8, health facilities management. We've put aside 1,774,275,000. The budget is directed towards clinic, community outreach, district hospital, emergency services, regional and tertiary services, training, medicine supply infrastructure, and governance system that makes service delivery possible. In conclusion, Honorable Deputy Speaker, we table this 21 billion for the consideration of this House in the month wherein we celebrate 50th anniversary of Soweto Uprising, and an event that changed the path of history in South Africa and the world, a historic event which earned young people their rights place, not only in the books of history, but in the struggle to be better people. So I call upon the current generation to honor that generation of Hector Peterson, Boyisa Makumbu, Sibongile Mkhabele, and many others by working with our department and civil society in confronting social ills which undermines their health. I wish to thank the Honorable Premier, Honorable Dlovu, for always guiding us in terms of making sure that we achieve what we have achieved. The Executive Council, members of the House, the Portfolio Committee led by Honorable Munene Hlongo, the Head of Department, Dr. Dlovu, and Management, Organized Labor, and our healthcare workers, community healthcare workers, ambulance personnel, hospital board, mental health review board, clinics, and municipalities. I am allowed to thank my organization, the African National Congress, especially the Provincial Secretary who's always supporting us in this House and also providing guidance in making sure that we implement our manifesto. And thank my family for always standing with me and supporting me. Honorable Deputy Speaker, I hereby table vote 10 of the Mpumalanga Department of Health 2026-27 financial year for consideration by the House and as evidence to support our conviction. Thank you very much, Honorable Deputy Speaker.
Thank you. Thank you very much, Honorable MEC, for a well-delivered budget speech. I now invite the Secretary to read the 8th order of the day.
Order number 8, consideration and debate on a report of the Portfolio Committee on Health, vote 10, Department of Health.
I now call upon the Chairperson of the Portfolio Committee on Health, Honorable M.N. Mhlongo, to table the report.
Thank you very much, Honorable Deputy Speaker. I rise on behalf of the Portfolio Committee on Health to table the report of the policy budget for 10 as presented for consideration by this August House. Thank you.
Thank you. I have a speaker's list in front of me. I will now take this opportunity and invite Honorable Mhlongo from the ANC. You are allocated 8 minutes on the debate on this budget.
Honorable Deputy Speaker, Honorable Premier, Honorable MECs, Honorable members of the Portfolio Committee on Health, Honorable members of the Provincial Legislature, the Chairperson of the Mpumalanga House of Traditional and Khoisan Leaders, and President of Contralesa, Khoshimkwena, and all traditional leaders present, heads of departments, invited guests. Today, as we debate this budget vote, we are not merely discussing figures and allocation. We are discussing the life of a child who needs medical care, a mother seeking treatment at a clinic, a cancer patient waiting for specialist services, and a family that depends on public health care for survival. The African National Congress remain guided by the vision of caring and developmental state that leaves no one behind. We believe that quality healthcare must never be determined by income, race, geographic location, or social status. Every South African is entitled to dignity, quality healthcare, and equal opportunity to live a healthy life. I am therefore honored to rise on behalf of the African National Congress to participate in the budget vote for the Department of Health for the 2026-2027 financial year. The Department of Health derives its constitutional mandate from Section 27 of the Constitution, which guarantees everyone the right to access healthcare services. It is on this basis that the Department of Health, in its vision and mission, intends to achieve the following: equal access to quality healthcare for all citizens, regardless of socioeconomic status; universal health coverage aimed at eradicating financial barriers to accessing care; and emergency medical care to ensure that all patients receive treatment in a life-threatening situation. The budget before us demonstrates government's commitment in reducing inequality and ensuring that people have access to public healthcare services. Honorable Deputy Speaker, we cannot forget where we come from. Before 1994, healthcare services were divided along racial lines, with resources distributed unequally under the apartheid government. Since the dawn of democracy, South Africa has introduced progressive laws and policies aimed at correcting this injustice and ensuring equal access to services. The National Health Insurance is one of the most important steps towards achieving this goal. It seeks to close the gap between those who afford private health care and those who cannot afford. Honorable Deputy Speaker, it is true that whenever a policy is intended to benefit the poor and disadvantaged, it is bound to face some resistance from those that benefit from inequality and transformation. The ANC, however, remains firm in its commitment to quality, justice, and universal access to healthcare. Passing the National Health Insurance is the only step in the right direction in realizing the aspiration of the Freedom Charter. Honorable Deputy Speaker, under the stewardship of MEC Manzini, we have witnessed tangible progress in the health sector. This includes state-of-the-art health infrastructure development. Middleburg and Betal Hospital are good examples of our commitment to infrastructure development. It is worth noting that the department has also built state-of-the-art CHCs that are fully equipped with all the necessary machinery required in a community healthcare center. We have also seen permanent placement for medical doctors in public facilities, strengthening service delivery at a critical level, which is something that has never happened before. Earlier this month, the rollout of innovation interventions such as Lenacapavir, launched by His Excellency President Ramaphosa, demonstrates that we are not standing still in fight of HIV and AIDS. Our clinics are stocked, functional, and serving communities. Academic hospitals such as Rob Ferrer continue to expand specialist services, offering dedicated oncology units that provide outpatient and inpatient chemotherapy services, proving that public health service can and does deliver world-class care when properly supported. These are not promises, these are outcomes. These developments demonstrate government's commitment in improving healthcare services for our people. Honorable Deputy Speaker, given our historical context of inequality, the ANC-led government has adopted a community-based approach to the healthcare delivery that brings quality services closer to the people. By strengthening primary health care and focusing on prevention, we are improving access for communities that were once underserved. We'll also continue to learn from successful international health systems, including the Cuban and Russian models, through cooperation and exchange programs that enhance health sciences training and build our healthcare capacity. Honorable Deputy Speaker, the Constitution places a non-negotiable responsibility on the state to improve citizens' health status through the prevention of illness, disease, promotion of lifestyles, and consistently improve healthcare delivery system by focusing on access, equality, efficiency, quality, and sustainability. Yet we must also face a comfort reality. The health system is under pressure, the rising number of non-communicable diseases is high, and that requires that we channel most of our resources in the fight against non-communicable diseases. These non-communicable diseases include high blood pressure, diabetes, cancer, mental health condition, and chronic diseases. We are committed to prevent NCDs, promoting healthy lifestyles, ensuring that early detection and effective treatment for those affected. Through the National NCD campaign, the Department of Health has increased screening conditions such as hypertension and diabetes, helping patients receive timely care and start treatment as early as possible. But let us be honest, we cannot fight diseases with unfunded facilities, understaffed clinics, overstretched professionals. Policy without resource is rhetoric. That is why this budget matters. Honorable Deputy Speaker, health is not a privilege reserved for a few. It is a constitutional right guaranteed to every South African. This budget before this House is not merely a financial allocation. It is an investment in dignity, well-being, and future of our people. We remain committed to ensuring that no child, no elder person, no worker, no vulnerable member of society is denied health care because of their financial circumstances. Honorable Deputy Speaker, all these goals and achievements can only be sustained if the Department of Health receives the financial resources required to carry out its mandate effectively. The budget before us will help us strengthen healthcare services, improve infrastructure, support healthcare workers, and ensure better health outcome for all our people in Mpumalanga.
As you wind up.
In line with the African National Congress' long-standing commitment, a better life for all, we proudly support Budget for 10. We do so for every child, every patient, every healthcare worker, and every family that depends on public health. We further call on this House to support this budget in the best interest of our people. Nzakensa, Honorable Deputy Speaker.
Thank you. I now call upon Honorable NC Ungane Mtsweni from MK Party. You are allocated 8 minutes, madam.
Honorable Speaker, honorable members of the legislature of Kosibonke, ladies and gentlemen, Lochan. Honorable Speaker, before I start debate, I must state up front that the department must stop budgeting for death and start funding life and dignity. I come from the clinic queue, not from a boardroom. Vote 10 is not budget, it is a matter of life and death. This is a budget of Ogogo in Bushbuck-Rish, who sleeps in the clinic gate at 3 a.m. to get chronic medication at 9 a.m. This is a budget of pregnant mother in Msugaligwa who gave birth on the floor because there was no bed. This is a budget of nurses in Rob Ferreira who work 24 hours shift with no gloves, no dignity. Honorable MEC, you will table 9 billion, but our people table empty shelves, broken X-ray machines, and ambulances that arrive 4 hours late. The MK party says, if vote 10 cannot keep our people alive, then budget must be rejected. Amandla kulondawo. Number 1, primary health care collapse, clinics without care. Honorable Speaker, our clinics are collapsing. Medicine shortage is now normal.
Patients are told come back next week, next month for ARVs, hypertension tablets, insulin. You cannot tell a diabetic patient to come back next week, next month. Next month, it's a coffin. Clinics in Komazi, Dr. J.S. Moroka and Tembisile Hani operate without doctors. Our nurses sees 200 patients a day. No gloves, no mask, no dignity of nurses or patients. And the building itself, leaking roofs, broken toilets, no security. Nurses are being robbed, patients are being raped in clinics' toilets. In this health or, is this health or a war zone? MK party demand zero tolerance for medicine stock out. MEC, publish a month list of clinic with shortage plus name of officials responsible. Fire them. Fast track hiring of community health workers plus nurses. Stop using frozen post as an excuse while people die. 24-hour security plus CCTV at clinics. If you can secure the legislature, you can secure all Koko collecting
Honorable
pills.
Bungane, my apology. May you take your seat. There's a point of order.
Not necessarily a point of order, Speaker. Kunomsindo la asikhona ukulalela ukuthi kukhulunywana, please. Awubacele. Basibangela umsindo. If banama ba opinionated abakhulumi masesiphuma la basidisturb. Thank you, Speaker.
Okay. No. Wait, Honorable Bungane.
Oh.
Members of the public who are requesting, you may proceed, Honorable Bungane.
Stone Kosh, kokugcina.
Honorable Stephen, no. We invited them and we must afford them respect that they deserve. Please, let's not converse at the back while members are speaking.
24-hour security plus CCTV.
Sorry, Honorable Bungane, there is a point of order from Honorable Kelly.
Thank you, Honorable Speaker. While Honorable Bungane asamile, isikhathi siyahamba lapha, zange simiswe. So can we please have that time stopped while we are dealing with the point of order so that he can be able to continue?
Okay. All right, Honorable Bungane, you may proceed.
Okay. 24 security plus CCTV at all clinics. If you can secure legislature, you can secure all Koko collecting pills. Number 2, hospitals where hospital goes to die. Honorable Speaker, our hospitals are not healing places. They are trauma center of neglect. Temba, Rob Ferreira, Mapulaneng, patients shared beds, some sleep on the floors. Operations are cancelled because there's no anesthesia. Cancer patient waits 6 months for chemotherapy. Ambulances, the EMS system is broken. A woman in labor in Komazi called 3 times. Ambulance came 5 hours later. Baby dies. That blood is on the budget. And the worst corruption, tenders for cleaning, laundry, security, it's millions. While ward have no linen, no food, no soap. Contractors get paid, patients get sick. MK party demand, publish the hospital equipment audit. Which hospitals have broken X-ray theaters, ICU beds? Give date for repairs, not excuses. Number 2, bring EMS back under direct government control. Privatize ambulance, chase profit. No patient, not patients. 1 ambulance per 10,000 people. That must be low. Blacklist and prosecute health tenderpreneurs. No company that supply expired gloves must ever touch a government tender again. Number 3, staff overworked, underpaid, disrespected. Honorable Speaker, nurses and doctors are not the problem. They are the heroes. But You work them like slaves. 12-hour shift become 24 hours. 24 hours. Overtime is not paid for months. Community service doctors leave after 1 year because there is no mentorship, no equipment. You cannot have quality health care when the caregivers is broken. A tired nurse make mistake. A demoralized doctor leave for Australia. MK party demand pay overtime 30 days, fill all vacancies post in 90 days, build decent accommodation for nurses near hospital, respect them, respect them with pay, protect them with security. Number 4, NHI plus moral crisis health is not a tender. Honorable Speaker, government talks NHI, but in Mpumalanga, we don't have here now. Before NHI fix what we have, you cannot insure people for services that don't exist. That's fraud. And there is moral crisis. Young boys rape girls in clinics' toilets. A manager steal COVID money. This is what happens when a society loses ubuntu. Health workers must be taught that umuntu ngumuntu abantu.
Okay.
A patient is not a number. A patient is someone's mother.
Okay. It's okay, member.
Lawa ma-minutes wa
I did
abuyile.
procure.
Uwabuyisile?
Yeah, I did give you some. I did give you some.
Fakele one.
No, honorable members.
Fakele one.
No, wait. No, wait, honorable members. Can we give a big round of applause for respecting the speaker? Thank you. We now proceed, call upon Honorable Tipping Kosi from the ANC. You are allocated 8 minutes. Your time will start as soon as you greet us. Okay. Thank you.
Deputy Speaker, Honorable Masango, Premier of the Province, Honorable Ndlovu, members of the Executive Council, members of the Provincial Legislature, Chairperson of the Provincial House of Traditional and Khoisan Leadership, Hoshim Kwena, Executive Mayors, distinguished guests, I greet you. Honorable Deputy Speaker, as I'm debating and participating in this budget vote number 10 for the Department of Health, I want to stress that healthcare remains one of the most fundamental responsibilities in the government of Mpumalanga. The quality of our health services directly affects the dignity, well-being, and productivity of our people. Therefore, the budget before us is not merely a financial allocation, but it is an investment in the lives of our citizens. It is not a box-ticking exercise, but an accountability on the commitments made on changing people's lives by providing efficient healthcare system. Honorable Deputy Speaker, MEC has mentioned that part of the responsibility is to disrupt the status quo that exists pre-1994. And the ANC, in its 2024 manifesto, committed itself in ensuring health care for all. The ANC further committed itself in moving decisively towards implementing the National Health Insurance and expanding the Ideal Clinic program so to improve the quality of care. Deputy Speaker, we welcome the allocation made by the Department of Health and acknowledge the efforts undertaken to improve access to quality healthcare service. That is the implementation of the ANC manifesto. The number of doctors contracted by the department in the 2025-2026 financial year, it gives us hope that this healthcare for all will soon be realized. The clinic and CHC constructed are an important milestone, and there are structures that are going to bring closer the Department of Health to the commitment made of ensuring health care for all. I'm happy that on the commitments that were made by the Honorable MEC in 2025-2026 financial year have been accounted for. That includes the King Yabela hospitals and many other examples that we can talk of. The success of this budget, Honorable Deputy Speaker, will depend on its ability to address the challenges which are important to be addressed, and the willingness and readiness of the department to respond to these challenges. Of course, we have noticed that there were so many issues that the MECs accounted on, which were challenges that were raised in this August House. We also welcome the investment which is aimed at strengthening primary healthcare services, expanding access to treatment programs, and improving healthcare infrastructure. However, I want also to put it, Honorable Deputy Speaker, that attention must be given also in the rural communities where the access of health remains a challenge. But we are happy with the statement with the policy statement that have been raised by the MEC. Honorable Speaker, the department must continue prioritizing recruitment and retention of healthcare professionals. When we're reading the report which is before the August House, it has been shown that there's much progress that have been recorded in that regard. Honorable Speaker, doctors, nurses, emergency personnel, and community healthcare workers are a backbone of the healthcare system. We also call for stronger intervention to combat HIV/AIDS, tuberculosis, mental mortality, child mortality, and the growing burden of mental health conditions that the MEC has talked about. Prevention programs, public awareness campaigns, and community-based healthcare services must remain central to this approach of our healthcare for all. We implore the department to maintain strong financial controls and effective oversight mechanism. It has also been mentioned on the speech by the MEC that there's a progress in insourcing services. Insourcing is going to increase the capacity of the state when services are provided. We are very much happy, and we like to say that the implementation of the healthcare infrastructure projects must be accelerated, and it must be ensured that facilities are completed on time within the budget and according to the required standards. In conclusion, Honorable Speaker, this budget presents an opportunity to strengthen our healthcare system and improve the lives of our people. I must inform this August House that as a member of the Portfolio Committee, it is a privilege for me to participate in that Portfolio Committee. Just like
Order, Chair.
Honorable Nkosi, may you take your seat? Honorable Steve, what's your point of order?
He can somewhere go and sit in his seat. The honorable member Ngosi is out of order. You don't stand up and take a platform without greeting Amakos. That's thoroughly out of order.
No, Honorable Steve. He have greeted all of us. Honorable Ngosi, may proceed.
Maybe it just went overboard. I greeted Amakos who are in this August House. As I'm concluding, Honorable Deputy Speaker, the true measure of this budget will not be an amount appreciated, but the impact it has on the daily lives of the people we serve. We have seen it happening. We trust the leadership of the MEC, and the ANC supports this budget. I thank you.
Thank you very much. We now invite Honorable NP Mkabela from EFF.
Fighter.
You are allocated 6 minutes.
She's a fighter.
Thank you very much, Honorable Deputy Speaker. I take this opportunity to greet the Honorable Premier, Leader of Government Business, Honorable Mashilo, Chairperson of the House of Traditional Leader and President of Contralesa, Kgoshi Mokoena, and your team, our honorable guests. Honorable Deputy Speaker, the EFF rise to engage on this health budget vote not as the
uncompromising voice of the poor, the unemployed, the sick, and the forgotten masses who depend entirely on a public health system that must either serve them with dignity or fail them completely. We speak here guided by the founding principle of the EFF, economic freedom in our lifetime, equal access to quality public services, and the radical transformation of the colonial, spatial, and economic order that continues to define service delivery in this province. Deputy Speaker, we acknowledge the progress made by the Department of Health, but refuse contentment because the lived reality in our clinics and hospitals still does not reflect the promises made in budget speeches. We know that the department has allocated funding for new clinics under construction, appointment of EMS personnel, procurement of ambulances and mobile clinics, among others. These are not luxuries, they are basic expectations in a democratic state that claims to value human life. We welcome any step that moves our people away from overcrowded corridors, broken equipment, and long queues where patients sometimes die before receiving care. Deputy Speaker, this budget speaks loudly, but the reality in our community speaks louder. We are confronted by a maintenance backlog with leaking roofs, collapsing infrastructure, and facilities that are no longer fit for human dignity. Speaker, we remain deeply concerned about the continued challenges of medication shortages, even though the MEC has spoken about it, but there is shortage of medications in our healthcare facilities. That is a fact. Patients on ARV, hypertension treatment, diabetes medication, and TB treatment are still not guaranteed their full monthly supply, forcing patients to return home empty-handed after waking up at dawn to queue. Healthcare facilities are met with severe staff shortages in nursing, EMS, and specialists, despite repeated promises of recruitment by the department. Our people are still waking up early in the morning just to spend the whole day in the queues at clinics, and in many cases, they leave without being properly assisted, while graduates are seated at home with the relevant skills and qualifications. We must also indicate, Honorable Deputy Speaker, that training healthcare workers in the province without ensuring proper absorption into the public service does not solve the crisis. It only produces frustrations and deepens shortages where they are already critical. We must also ask ourselves what is the meaning of the 20 billion plus health budget if clinics still run without medicines, ambulances without drivers, and hospitals without specialists. Our people are being forced to live their lives on interrupted treatment because this health system cannot guarantee health care. That is unacceptable. We therefore call for the immediate filling of critical vacancies and expansion of permanent employment in clinics and hospitals. The FF has always maintained in its manifesto that public health must be free, accessible, and quality-driven. Public health must be properly staffed and fully resourced. It must be protected from corruption and maladministration. Clinics and CHCs like Langeloop CHC, also in despair, facilities are leaking roofs, broken plumbing, rusted structures. Deputy Speaker, a hospital with a leaking roof is not a hospital. The EFF believes infrastructure is not just bricks and mortar. It is the physical expression of human dignity. When infrastructure collapses, dignity collapses with it. Honorable Deputy Speaker, we cannot ignore the crisis in emergency medical services in rural areas. Waiting over 60 minutes for an ambulance is not a statistic, it is a death sentence. The EFF rejects any normalization of this reality. We also know the procurement of tablets, mobile clinics, vaccines, fridges, and buggies, but we must warn you that procurement is not service delivery. Without maintenance capacity, without trained personnel, without functional systems, these become temporary announcements, not lasting solutions. We do not want to purchase agents, but we want service provision. On a lighter note, Deputy Speaker, we welcome the Department of Health's decision to implement and continue rolling out the EFF's long-standing call for the operation of community clinics on a 24-hour, 7-days-a-week basis. We believe that healthcare must not be restricted by working hours because people fall ill at any hour of the day or night, and access to care must be continuous and consistent. However, Deputy Speaker, implementation of this decision must be consistent, properly resourced, and extended to rural communities, not only implemented in selected areas for reporting purposes. We acknowledge the installation of CCTV cameras in selected health facilities identified as crime hotspot as part of efforts to enhance staff and patient safety. However, we must be clear that cameras alone are not enough. Technology cannot replace the need for visible, permanent, and properly trained security personnel at our healthcare facilities. We call for the permanent employment of security staff across all clinics and hospitals, not selective coverage based on hotspots. Our health facilities must be protected physically, monitored digitally. Speaker, we also call for urgent and decisive action on fraud and corruption cases within the department. These matters cannot remain unresolved while resources meant for healthcare delivery are lost through maladministration. Accountability must not be delayed. As the EFF, we support a vision where a child does not die waiting for an ambulance. We support a vision where a mother does not give birth in a corridor. We support a vision where clinics does not run out of basic medication and a hospital roof does not collapse while budget increase. Honorable Speaker, healthcare is not a favor from the government. It is a constitutional right and a revolutionary demand of our people. We will support this budget vote, but with serious reservation. We are not giving the department a blank check. We are issuing a warning that implementation must improve or confidence will continue to erode. We will closely monitor medication supply, staffing levels, clinic performance, infrastructure delivery, and accountability processes, because budget without delivery mean nothing to our people. We support this budget vote, Honorable MEC, with those reservations.
Thank you. Your time is up. We now call upon Honorable B. Grobler from Democratic Alliance. You are allocated 5 minutes.
Thank you, Honourable Deputy Speaker. Greetings to the House at large and all protocol observed. Honourable Deputy Speaker, the MEC has just delivered a department's budget bait for the 2026-2027 financial year. And like many other departments, but this one specifically, as I said earlier in my member statement, there's not only doctors in this department, there's a lot of spin doctors. And when we listen, and MEC, I did listen very carefully, like you said in the beginning, one gets excited because there's exciting things that happen. You hear about clinics that's being refurbished, and you hear about ambulances that are being bought, and you hear about the cataract surgeries that are performed, and you hear about strategies that are drafted, and you want to get excited. But we as public representatives walk out in the field, MEC, and I'm sure you do too as well. But I think you must sometimes take off your yellow t-shirt and maybe just wear a normal black or white t-shirt so that people can't identify you from a party. And then you go out and you listen carefully what people honestly say about the health system in this province. All of the members that have spoken, including the member from the ANC, all say exactly the same thing, and that is that this department is under pressure. This department is saying things, but we are not implementing. And it's very much like the saying, we are now rearranging deck chairs on the Titanic. The ship is sinking, but we are playing around here with a few reports to make it look better. Honourable Deputy Speaker, financial management is very important if you have a budget of 21.1 million rand. How do you do financial management? You budget, you plan properly, you plan against performance indicators, and then you implement and you monitor and you see. What we see here, Honourable Deputy Speaker, is that this department reduced their performance indicators from 96 to 60. This means that there's 36 performance indicators that won't be tracked anymore. And according to the department, this will make it easier to manage, and it will help the focus in the department. However, Honourable Deputy Speaker, the reason doesn't seem convincing me. And if you look at the targets that was removed, targets relating to pneumonia, to diarrhea, severe acute malnutrition, and medico-legal claims, it really does look like we are taking the pressure off ourselves in the paperwork. It's very worrying that we are on 9 billion rand of medico-legal claims in the province. We're just making the paperwork work better. My heart goes out to EMS personnel in this province. These poor colleagues sitting here to my left don't need another 32 people appointed in EMS. They need 132 MEC. We don't need to buy ambulances. We need to operationalize the ambulances that we have got in the province. The research unit, which we had a great tussle about last week, is a great example of how we just work with papers and work with reports, but nothing comes out. 2.6 million rand spent on 3 officials that didn't produce a single research document. The Titanic's orchestra is playing, but the ship is sinking. The department admits to 1.4 billion rand in infrastructure maintenance backlogs, yet only 35.2 million rand was allocated for maintenance in the 2025-2026 financial year. Apprentices and artisans have been appointed, but this is only a drop in the ocean if we compare it. It's not even 3% that we budgeted. While projects like Mapulaneng and KwaMashlanga maternity ward remain delayed due to poor contractor performance. The department reported an insufficient budget due to the underspending. And I think this is, for me, the most shocking part. We report insufficient budget due to underspending, yet the department requested 277.544 million rand rollover. We cannot continue to shuffle funds between programs while patients wait for beds, ambulances, and medicines. This is the very definition of rearranging the deck chairs. We need decisive action, MEC, and I think it's important to really go and listen to what people of the province say. And then we take it program by program, department by program by program, hospital by hospital, clinic by clinic, and we install a culture of discipline, a culture of work, a culture of getting real value for money for every rand spent in the department. And that will make a difference in the lives of the patients. Thank you for achtbare ondersteuning.
Thank you. We now call upon Honorable W.L. Welber from Freedom Front Plus. You are allocated 3 minutes.
Honorable Deputy Speaker, before I start my address, I want to express my severe disappointment. I was once again presented with a pack of condoms, but the flavor is wrong. Notwithstanding the fact that you call me I prefer strawberry flavor, and I've told this gathering more than once. Please remember that. Honorable Deputy Speaker, some time ago I was admitted to a private hospital here in Nelspruit. All the staff were black, but the treatment and the care was excellent. It was world class. I was treated like royalty. But I am informed that in the public hospitals, which are not functioning very well, the same people, the same staff, work in shifts, and if they completed the shift in the private hospital, they move across to the public hospital, and then there the care is not world class. The problem and the reason for that is not race, it's management. Because in the private hospital, the management is being appointed on the basis of managerial ability. In the public hospital, management is being appointed on the basis of cadre deployment. The public hospitals will never be fixed until you stop cadre deployment in the management sector. I thank you, sir.
Thank you very much. We now call upon Honorable F.T. Mashiane from SNSA. You are allocated 3 minutes, ma'am.
Honorable Deputy Speaker, I greet everybody, all protocol observed, but I'd also like to greet in absentia Dr. Jose Diklape, the founder of Africa Medical Association and the former president of World Medical Association, who's representing Action SA in the National Assembly. Honorable Speaker, healthcare is not a privilege. It is a constitutional right, yet for far too many people in Mpumalanga, quality healthcare remains determined by where they live, how far they are from a clinic, whether an ambulance arrives on time, or whether critical vacancies have been filled. Action SA has carefully considered Budget Vote 10 and notes that the Department of Health has been allocated an extra 7.3% from the previous financial year. We welcome this investment. We welcome the allocation of 12.78 billion to district health services, which accounts for more than 60% of the department's budget. We welcome funding for 9 mobile clinics, the establishment of a new neonatal ward at Standerton Hospital, and additional investments aimed at strengthening healthcare services across our province. However, Honourable Speaker, budgets do not save lives. Implementation saves life. The people of Mpumalanga are tired of hearing about plans but never materialize. They are tired of project delays, procurement disputes, infrastructure failures, and staffing shortages that continue year after year while communities suffer the consequences. One of the clearest examples is the EMS. At a time when residents need faster emergency response time, the department has reduced its own target for urban response times from 65 to 45. For Action SA, this is unacceptable. A mother in labor, a child in distress, a victim of a vehicle accident cannot wait for administrative explanation. They need an ambulance when they call for one. We therefore expect urgent progress in filling the promised EMS positions. We are equally concerned about the department's financial positions. Infrastructure remains another major concern. The department faces a maintenance backlog of 1.46%. Action SA, Honourable Speaker, Action SA contains the resources necessary to improve healthcare outcomes in Mpumalanga. For that reason, Action SA will support the budget, but our support is unconditional. We expect the department to demonstrate measurable progress in ambulance availability, vacancy filling, infrastructure maintenance, financial management, and service delivery. We will continue to monitor implementation closely and hold the department accountable for every commitment made in this House. The people of Mpumalanga deserve a health care system that works. They deserve more than promises. They deserve results. I thank you.
Thank you very much. We now move to Honorable F. Mulombo from the ANC. You are allocated 8 minutes.
Honorable Deputy Speaker, thank you very much. Let me take this opportunity to acknowledge your presence to greet the Honorable Premier, the leader of government business, the members of the Executive Council, the chairperson of the House of Traditional Leaders, Hoshi Mukwena, and his delegation, my colleagues in the provincial legislature, and our esteemed guest in the gallery. Honorable Speaker, I want to extend my appreciation to you, Deputy Speaker, for affording us another opportunity to account to the people of Mpumalanga on the progress that we have achieved in exercising oversight over this Department of Health in the province as it implements its mandate of delivering improved healthcare systems to the people of Mpumalanga. We do so, Honorable Deputy Speaker, with the greatest appreciation of the privilege that has been given to us to serve the people of Mpumalanga. In that context, this debate to us as the African National Congress shouldn't be about political point scoring or about political grandstanding, but it should be about giving a blow-by-blow account of the setbacks that we have encountered and the progress that we have achieved in building momentum, capacity, and the building blocks towards achieving a truly national democratic society. The report of the department on its APP, the annual performance plans and the budget, was presented to us as a portfolio committee, Honorable Deputy Speaker, and we are pleased to indicate that this Department of Health has made substantial, considerable, and significant progress in achieving both the provincial health outcome targets and also the Sustainable Development Goals targets. I want to confirm, as a member of that portfolio committee, that this report that the Honorable MEC have just spoken to does conform with the majority of the provincial legislations that governs health in this province. It complies and conforms with the National Development Plan and also the manifesto of the majority party, the African National Congress. The department has made commendable progress in addressing the key performance outcomes, amongst them, and I think we have heard when the Honorable MEC was addressing, amongst them being the increased life expectancy for both men and women, the decreased maternal and child mortality rate, the improvement in strengthening the health systems, and the eradication of extreme poverty and hunger. Having said that, Honorable Deputy Speaker, allow me to join my colleagues in requesting this Honorable House to adopt and approve the budget of the department, which is, or the allocation that has been allocated to the department, which is 21,193,365,000. The Honorable MEC has addressed most of the achievements that have been achieved by the department. But Honorable Deputy Speaker, please allow me to speak with passionate conviction on the following. In nearly all our villages in the province, the department has built the state-of-the-art clinic or community health care facility. In the process of building those facilities, this department has created a lot of jobs, but also provided a service to the most vulnerable in our society. Our hospitals are being radically revamped, and new hospitals are being built where there is none. The King Nyabela Hospital in the Steve Tshwete municipality, it's a shining example of the capacity that the province of Mpumalanga has to deliver the state-of-the-art infrastructure. This department is doing extremely well in absorbing community healthcare workers in the province so that they become fully employed. So, Honorable Deputy Speaker, let us please give the Honorable MEC her flowers while she can still smell them, because she is truly the best amongst the best. She is a pioneer. She is a trailblazer. She is a groundbreaker, and she is a trendsetter. She is an organic product of our movement. Yes, Honorable MEC, I agree with you that you should not plead guilty because you are not guilty of lacking the courage to try.
As you wind up.
But you have marshaled your forces with passion and distinction to achieve all the good things that you have achieved in this department. So I should not be blamed when I say that you are not guilty of lacking the courage to try, but you are guilty of setting a bar that those who will come after you will struggle to match. You deserve my salute, and thank you very much, Honorable Deputy Speaker.
Thank you very much. We now invite the Honorable MEC, Manzini. We now invite the Honorable...
Deputy Speaker, sorry, Honorable Mlombo dropped his honey brush there.
Yeah, just hold on. Honorable Manzini, you may come in.
No, thank you very much, Deputy Speaker. Let me welcome all the input made by the honorable members in contributing towards the debate. But let me start by indicating that what is good in terms of the Department of Health, Deputy Speaker, is that we don't set the standard ourselves and we don't monitor our own performance. The Department of Health have independent bodies, not only in Mpumalanga, that monitor the implementation of services, and they tell us in terms of your own performance. So it's not me. You can go anywhere, you'll get in terms of where we. I can indicate, Honorable Mhlongo, really appreciate that indeed, as the chairperson of the portfolio committee, we always come and account in terms of the work that we are doing. And we have no doubt that you'll continue to do a good job in terms of making sure that we come and provide even portfolio of evidence in terms of what we are saying. I know if honorable members, indeed, what they were saying here, it is not true. I will all know. But because, of course, it's a debate, and you know, there are people from the community, so they will say all these things. Let me also indicate that, indeed, as a Department of Health, it's effective in the Honorable Premier debated national, talking about the first ever, where in the province we took doctors to communities, something that has never happened. You will say we are lying. No, but the people from all these communities, they are happy, they are celebrating. You know, if you have got a medical aid, you'll come here and say all these things because you don't benefit out of what our community are benefiting on a daily basis. So thank you very much, our chairperson. Honorable Mtsweni, you know, if really indeed what you are saying, people are dying, in terms of the stats, national, we are at 8.96 in terms of the crude death. Ask where are we in terms of Mpumalanga? In terms of Mpumalanga, we're at 5.5 in 2015-16. Currently, as we speak, we're at 4.5. Actually, we don't go around and say people are dying. We will look at stats in terms of how many people were admitted and how many people were discharged from the hospital. These are not me saying, go and look at the stats, it will tell you where are we in terms of the province, in terms of people dying. As Mani City, some people will die. May their soul rest in peace. But in terms of the stats as a province, that's where we must start and say, this is where you are. Indeed, in Mpumalanga, you are the worst ever province. People are dying like nobody's business in the country. Hence, the MEC, indeed, you are making people in the province to die. But in terms of the stats, there's nothing that is backup your allegations. And in terms of Department of Health, because everyone knows that you can't deal with health in isolation. Hence, we've got governance structures. There are governance structures in each and every clinic. There are clinic committees. There are ward councillors sitting there on the basis of your people are sitting in all our clinics to make sure that the people that they are die, in terms of services, whether they are happy or not. Because we understand that health can't be a matter of the MEC Manzini and his or her employees. No, we want people to monitor the provision of service at a local level. So the ward councillor also is not even elected because it's democratic. MEC maybe for members. So no, it's democratic. The community themselves, they appoint their own clinic committees and they are able to monitor services at the clinic committee and also in terms of the hospital. So that's how transparent we are. in terms of the Department of Health. Even if but we are fihla, there's no way ungafihla ufihla wonke umuntu. And then namalanga in the social media and everything else, I'm also there. I've also allowed them to use my personal account to report and be able to say these are the things that are not happy. And we are resolving everything with them. So these are the structures that, if indeed what you were saying in terms of, and in terms of HIV and AIDS, I must tell you that there are structures. Even the Premier doesn't have an impact where civil society, I'm talking about the users of ARVs. I have meetings with them and I ask them, are you happy? You know, these days, when I meet with the users of HIV, not us who are saying they don't have what, the users, they will tell me, MEC, in one meeting, they were even saying, Honorable Premier, they start talking about roads and water. Why are they saying, even I was saying, hey, they were in ama ARVs, that's why I'm talking about the users of these ARVs. But Tinangoba, we are not using them. That's why it's easy to say about ARVs. We do have ARVs because they've got a direct contact with me in terms of making sure we have enough ARVs in the province. Towards the end, the way the money is as it every month, backup, backup, storage where we can give them even for 6 months. In terms of, that's why, not even, we give them 6 months, those who are stable. Some we give them 3 months. Those who are still not stable, we give them month to month. That's how enough ARVs in the province. And I'm not saying this, I'm saying the users, they are structured, they've got structures themselves, they talk to me. I'm a complaint. Say, kuzo complaint, I don't have a problem. Honorable, you know, when you are saying that the budget is for death, it's indeed it's because maybe we are not using these facilities. And Honorable Dipinkosi, thank you very much also in terms of what you are saying. We were with honorable members here when there was a TLP at Deep Jail Clinic. Hey, but honorable members, where's Manubona Bantu Niakak? Nashai Zad, Shalanshai Zad, Amasezama oversight. Nibong, Mohammed Nessa Sebes, Nibong and a clinic clean. Everything. And when you go to a clinic, we give you the status of that clinic. So that thing is into the South Africa, in Pumala. We speak to that facility where we are with you, backed by stats in a facility, and medication availability is a young and is born in terms of where we are as a province. So what we are saying is not something that does not have facts. It's not backed with facts. It is backed with facts, and you know it. Just that in Joba Sisho Kutu Namla, Kufuna Sukulu, Bahambe, at least Kubekona Ababera Nagamufa. So, Honorable Weber, I'm getting complaint myself from patients who are going to private hospital and the treatment that is not good. I'm happy that when you got the best treatment ever. But I even told those CEOs of Mediclinic when I was with the meeting with the Honorable Premier when they were opening a unit, I told them that I also get complaints because they know that I'm responsible for health in the province. So even when they are not treated well in the private sector, they call me. So it's well and good that yourself you're treated well, but indeed you must deal with attitude. I'm happy organized labor is here with us, and every time we get a complaint, and that's why we are encouraging people to say, in terms of the Department of Health, you don't complain after 5 days. It's everywhere. And people are using it. And I must tell you, they are not abusing it. So if you are saying, when I number I can't take it out, even your premiers, they keep. And I can tell you that they are not abusing it. They call me and they are not abusing me. They call me when they have a problem and I tell them, complain to me while you are still there. My number, I was CEO, publisher, I said to the department, any person whom we are paying your number, it must be out there because we are all representing the community. So our people, I'm saying to them, we are going to release again the numbers from the HOD. Any person in number epatala department. Simtshele kahle ukuthi uma ungafuni community kufonele kulo msebenzi ocashela kuwo sinikezele phone yethu back so that singazokuhlupha. Mara asifuni le yakhe personal, sifuna le every month thina as a department that we are paying. Our people, they know. Hence we have extended in terms of these governance structures also because we are encouraging people, because once you do that, we are dealing with litigation because there are so many things we are able, even honorable members here, they call me when there's a problem. But hey, they have never raised them anywhere else. But I understand, as I've said earlier on, it's a debate. So we must debate in terms of everything that you and ushilo honorable Sidibe lapha uthi bayokhethweni. So kunzima madoda. We are 6 months, 5 months towards. So funa vele kubonakale ukuthi there's something that is happening. So but we really appreciate in terms of the input that we have made. EMS, Honorable Mtsweni, I don't know which EMS have we outsourced, because in the province, EMS is associated. We are using our own EMS in the province. We have not outsourced any EMS in the province. And the 32 that we are talking about, it's not only 32. We said 32 in the last financial year, and we are adding another 32. And I mean, I was happy that the department administration, at least we are moving towards that, because we're buying ambulances, and also we added now in terms of the employees. Seated there, they will be happy that at least we are adding in terms of the personnel, in terms of the services that we are providing to our people. So we think that indeed, we said it. We're not saying all is well, but we are saying, Tina, back with the stats. Honorable Premier, you say you don't want to be number 3 from the bottom. Hi, in terms of the health, you are not number 3 from the bottom. No. Udlalela khona lapha phezulu. Uma babala nje ma priorities, siyavela. Siyavela lapha phezulu in terms of everything. So the team that is here committed, I must salute them. They are not all the same. It's like your own kids in the family. They are not the same. But majority of them, they are doing everything possible to save our people. And those are backed by the stats in terms of where we are as a province. But where we are not doing well, we are able to come and say, la kukafiki, la sizofika. But together with our communities who are very happy, to say it myself, they are very happy in terms of the service that they are getting from our facilities. And bakhona laba abancane abamoshayo, but generally, they are happy. And thank you very much. Thank you very much, Deputy Speaker.
Thank you very much, MEC. Honourable members, that conclude the debate on vote 10. I now put the question before the House whether we agree to adopt the report.
Agreed.
As tabled by Honourable Mhlongo.
Agreed.
Thank you. So agreed. I now invite the Secretary to read the 9th order of the day.
Order number 9, policy and budget speech on vote 6, Department of Economic Development and Tourism.
I now call upon the MEC of Economic Development and Tourism, Honorable J. Saidal, to deliver the policy budget speech.
Thank you very much, Honorable Deputy Speaker, for the opportunity. The Honorable Premier of our beautiful province of the Rising Sun, Honorable Premier Mandla Ndlovu, thank you so much for setting the tone in the morning and indeed leading in terms of responding to the just above 5 million of the people of Mpumalanga as to how are you going to respond to inclusive economic growth, create jobs, and tackle the high cost of living, indeed in a manner in which it is transparent, we are held accountable, ethical, and also developmental as a province of Mpumalanga, and indeed giving my good self the mandate to implement those priorities, of course supported by all sister departments, as they are the enablers for the economic growth of the province of Mpumalanga. I want to also acknowledge the Honorable Chairperson of the House of Traditional Leaders and Khoisan, who is also the President of Contralesa. If you understand why Mpumalanga is called a rural province and at the center of economic development should be the key stakeholder, our traditional leaders, and your delegation you are acknowledged this afternoon. I want to also acknowledge Deputy Speaker, the chairperson of the Portfolio Committee, as well as all Portfolio Committee members, as well as all honorable members of the Provincial Legislature, the Director General in the Office of the Premier, leading the administration of the province, the Head of Department, Ms. Imi Serakalala, and all HODs that have been present this morning and this afternoon, to our chairpersons of the boards, as well as our CEOs of our public entities, leaders of business, labor, and social or civil society, the resilient people of Mpumalanga, the place of the rising sun, esteemed guests, members of the media, ladies and gentlemen, sanbonani. Honorable Deputy Speaker, I stand before this House today with a profound sense of humility and absolute responsibility to table the policy and budget speech for Vote 6, which is on the Department of Economic Development and Tourism for the financial year 2026-2027. We gather at the time of a distinct transition. Just 3 months ago, our provincial budget laid bare the socio-economic tightrope we walk. Globally and internationally, we face volatile commodity markets and structural economic headwinds. Locally, we look at the provincial poverty rate affecting 52.5% of our citizens, and youth unemployment rate sitting at an alarming, staggering 47.3%. While the global geopolitical tensions, especially supply chain disruptions in the Middle East, pose risk to our agricultural exports and local farmers, our domestic metrics are highly encouraging, Honorable Deputy Speaker. These are not just mere statistics, they are a clear call to action. They tell us that our public resources cannot simply maintain the status quo bureaucracy. We must work to disrupt poverty, restore human dignity, and transform the place of the rising sun into a self-sustaining, globally competitive powerhouse. Our work remains anchored by the Mpumalanga Economic Reconstruction and Recovery Plan and our Vision 2030 employment targets. Our mandate is unambiguous. We must catalyze our high absorption sectors to add at least 60,000 sustainable jobs annually to our provincial ledger. We are happy that the tide is beginning to turn, Deputy Speaker, backed by a stabilizing national economy showing signs of restored credibility. Our provincial growth is projected to steadily at a 1.3% this year, with an upward trajectory towards 1.9% by 2027. Agriculture, finance, transport, and tourism are anchoring this defense, and today we allocate the ammunition to accelerate the momentum. Honorable Deputy Speaker, let me borrow from our revered revolutionary and visionary leader, Istwalande, Dr. Nelson Mandela, who once posited that, I quote, "It always seems impossible until it is done," unquote. This statement serves as a profound reminder that daunting challenges often look unsurmountable until we act, commit to the work, and push past the fear of the unknown. I am of the firm view that these wise words are thought-provoking, they inspire hope, and most importantly, resonate deeply with our conviction as a department. We believe that it is indeed possible through our collective efforts and commitment to change the lives of our people for the better, as envisioned by our forebears. Honorable Deputy Speaker, to breathe life into our economic mandate, we are presenting this policy and budget speech at a decisive moment for our country. Earlier this year, during the January 8th statement, the governing party, which is the African National Congress, declared 2026 as the year of decisive action to fix local government and transform the economy. The ANC, as the leader of society, understands that it will be practically impossible to attain the aspirations espoused by the National Democratic Revolution without efficient and proper functioning of local government. Local government is a critical sphere of government which serves as the proverbial engine, room, and the heartbeat of service delivery. It is worrisome that historically the fact is that our economy has not transformed. It remains skewed and in the hands of the minority. The current economic trajectory continues to deepen and entrench high level of inequalities we are experiencing as a country. Therefore, we require a radical paradigm shift to change the economic landscape so as to bolster the arsenal in the fight against stubborn triple challenges of unprecedented level of unemployment, inequality, and poverty. As a department, we have a unique responsibility to ensure that we contribute meaningfully to the project of fixing local government by fulfilling our legislative mandate of championing local economic development through strengthening our support to the informal sector of our economy, leveraging on the district development model. Honorable Deputy Speaker, in tabling our department's budget, we do so on the principle of profound milestones in our nation's history. In exactly 5 years from today, South Africa will commemorate the 50th anniversary of the June 16 Soweto uprisings. Half a century ago, the youth of 1976 laid down their lives, marching against an oppressive system to demand a fundamental right, a dignified, equitable education. They fought for the right to choose their future. Today, the class of 2026 inherits that legacy, but their battlefront has shifted, I must say, Deputy Speaker. Their struggle is no longer against forced language policies in the classrooms. It is against the structural chokeholds of poverty, inequality, and unemployment. As a department tasked with steering the economic ship of the province, we recognize that political freedom without economic freedom is incomplete victory. We cannot honor the sacrifices of 1976 while 52.5% of our people live below the poverty line and our youth remaining on the margins of economic participation. Therefore, this budget framework is not just a ledger of numbers. It is a direct response to the economic aspirations of our youth. It is a tool for transformation designed to remove our young people from being mere spectators of economic growth to being its primary drivers. While we table this budget as a declaration that the government will continue to dismantle the shackles of economic exclusions, we are investing in our youth, restoring dignity to our communities, and ensuring that the rising sun shines brightly on every young entrepreneur trying to build a better future. Around the Mpumalanga's economic landscape, Honorable Deputy Speaker, the predicted economic landscape up to 2029 to 2030 foresees the highest economic industry growth in agriculture, finance, the transport and communication industry, as well as construction. Our provincial priority sectors or industries will continue to be agriculture and agro-processing, as well as mining, manufacturing, tourism, and the green economy, as per the Mpumalanga Economic Growth and Development Plan. And in our quest to turn the tide on the provincial economy, our department is currently busy reviewing the plan to incorporate economic plans and interventions. The review of this economic blueprint will be crucial to also address the growth and employment challenges of especially a key industry such as manufacturing. In addition, Honorable Deputy Speaker, our department is also currently reviewing its provincial trade and investment strategy to also include the identification of a new export opportunities and markets for our province. In terms of growing the economy through reindustrialization and localization, Honorable Deputy Speaker, when we stood before this August House last year, we pointed out that the department has already developed a provincial industrial development plan that seeks to increase the industrial base in the province with a view to creating job opportunities for our people. We further indicated that there are few initiatives that are already being rolled out in this regard, namely the Nkomasi Special Economic Zone in Nkomasi Local Municipality, as well as the Petrochemical Industrial Park in Sekunda in the Governing Mbeki Local Municipality. In this regard, I must say that I am pleased with the progress made at the SEZ, as the project has now gained significant traction. The infrastructure development program continues to mark measurable progress, particularly in the advancement of the bulk water, roads, and electrical infrastructure. However, key challenges such as the scope changes in sewer infrastructure and gaps in the professional service provider appointments require focused attention as we move forward. Overall, the project remains on track towards achieving infrastructure readiness, with milestones achieved in bulk roads infrastructure, bulk electricity infrastructure, and internal electrical services. Undoubtedly, the Nkomasi SEZ is a vital catalyst for the province's economic transformation, job creation, and poverty reduction. The entity is the axis of economic integration, linking Mpumalanga, Gauteng, and Limpopo with the neighboring Kingdom of Eswatini and the Republic of Mozambique. The attainment of the key milestones in the implementation of the entity's strategic goals is testament to the commitment of the provincial government to position the Nkomasi SEZ as a catalytic project to stimulate economic growth, reduction of unemployment and poverty. And in line with its crusade to strengthen partnerships and collaborations with key strategic sectors of our economy, the Nkomasi SEZ has signed a memorandum of understanding with the University of Mpumalanga, as alluded upon by the Honorable Premier in the morning, in terms of us promoting innovation, research, and development. At the heart of this MOU is the drive to ensure that the local communities benefit from the Nkomasi SEZ's industrialization and investment opportunities. This partnership is also aimed at aligning academic expertise with the entity's operational objectives. Honorable Deputy Speaker, honorable members, the Nkomasi SEZ has to date signed an investment agreement with DP World, and there are other several investment engagements that are advanced and have reached critical stages with Vutomi Energy, Libombo Cotton Gin, as well as the InnoTech Renewable Fuel Solution. With regards to the envisaged energy SEZ to be located within the Steve Tshwete local municipality, we can confirm that the feasibility study has been finalized and the project has been found to be both technically and financially viable. With regard to the Petrochemical Industrial Technology Park, we are pleased to report that necessary conveyancing processes and the township register have been successfully completed, marking a significant milestone in the implementation of this strategic project. During the current financial year, the department will focus on the development of the terms of reference for the appointment of engineering service providers to undertake the required technical and engineering services. Furthermore, a funding application will be submitted to Infrastructure South Africa to secure financial support for the detailed design phase of the project. This initiative represents a significant step towards positioning Mpumalanga as a competitive petrochemical and industrial hub, while creating opportunities for investment attraction, enterprise development, industrial diversification, and sustainable job creation. Around us investing as a province in the green economy, we are saying, Honorable Deputy Speaker, our department continues to place the green economy at the center of Mpumalanga's economic diversification agenda. This must not be viewed as a departure from the province's industrial base. This is a practical response to the changing structure of the economy, which propels us to invest in new areas and the need to ensure that communities, workers, and enterprises are not left behind as the transition unfolds. During the 2026 State of the Province address, the Honorable Premier Mandla Ndlovu acknowledged the role of Mpumalanga Green Cluster Agency in facilitating the transition of the provincial economy towards the green economy. Honorable members, when we tabled the 2025-2026 policy and budget speech last year, we highlighted some catalytic projects in the green economy space which have potential to create job opportunities and propel inclusive growth in the province. Therefore, allow me to report on the progress recorded thus far on the realization of these high-impact projects. We want to start by really reporting on the good progress that has been recorded by the Umbila Emoyeni Wind Energy Project, which continues to make significant progress and remains one of the province's flagship renewable energy investments. We are pleased to report that phase 1 and 2, with an estimated generation capacity of approximately 155 megawatts, is at an advanced stage of construction and is nearing completion. Notable progress has been achieved on site, with more than 25 wind turbines already erected. Furthermore, phase 3 of the project has successfully reached financial close and construction activities have commenced, alongside the earlier phases, demonstrating continued momentum in the rollout of this strategic development. A major milestone has also been achieved with the completion and handover of the 400/132 kilovolt of Vunumoya main transmission substation to Eskom. The substation has energized and is now facilitating the grid integration, which is critical for the successful operation of the project and the delivery of electricity into our national grid. Construction is actively underway across both the wind generation facilities and the associated transmission infrastructure, positioning the project to make a substantial contribution to energy security, economic growth, investment attraction, and job creation within the province of Mpumalanga. Furthermore, I am pleased to report to the House that the Grootfontein Climate Smart Horticulture Center, located within the Palisang local municipality, has been officially launched as a strategic partnership between Eskom and the Kingdom of Netherlands, aimed at advancing climate-smart agriculture and creating sustainable economic opportunities for our local communities. The initiative is expected to contribute significantly to job creation and agricultural development over the next 5 years, while promoting environmentally sustainable and climate-resilient farming practices. A key milestone has been implemented in terms of training and skills development program, which is already empowering participants from the Baliseng with practical agricultural agribusiness skills. Without any doubt, the Center stands as an important example of how strategic partnerships can drive innovation in agriculture, enhance food security, create sustainable livelihoods, and contribute to economic growth in our province. As part of the progress made on investment commitments secured during the Mpumalanga Green Cluster Agency during our mining and investment conference held in October 2025, I am pleased to report significant developments regarding the Highveld solar power plant, a 240 megawatt solar photovoltaic project being developed in Emalahleni by Pella Green Energy. This strategic investment is valued at approximately 4.3 billion. The project is expected to make a meaningful contribution to the local economy through the creation of an estimated 179 employment opportunities during both the construction and operational phases. We are encouraged by the progress achieved to date, Deputy Speaker, with the project having advanced into the development stage. This project demonstrates the province's growing attractiveness as a destination for renewable energy investment and underscores our commitment to energy security, economic growth, industrial development, and sustainable job creation for the people of Mpumalanga. Honorable members, we are forging ahead with our plans to host the much anticipated Mpumalanga Energy Investment Roundtable. The envisaged roundtable will bring together industry associations, developers, national and provincial departments, regulatory authorities, and other key stakeholders to deliberate on strategies geared towards unlocking barriers affecting the rollout of renewable energy and just energy transition related to infrastructure in Mpumalanga, and that roundtable will be led by our Honorable Premier. Accordingly, through the Mpumalanga Green Cluster Agency, the department will continue to support a transition that is coordinated, inclusive, and investment-led. Around revitalization of tourism and conservation, honorable members, tourism remains one of the strategic sectors for economic growth and transformation, massive job creation, and inclusive development in our province. Tourism is undoubtedly the goose that continues to lay the golden egg for our province of Mpumalanga. And for the province to retain its second spot in terms of the international tourist arrivals, the department will continue to strengthen its support to the Mpumalanga Tourism and Parks Agency on its program to revitalize aging infrastructure and the introduction of new tourism products. We are fully aware that if we are to remain one of the biggest powerhouses in the tourism sector, we need to go beyond relying solely on the beauty of Mpumalanga. Hence, we are committed to work with the private sector to introduce new catalytic products that attract more tourists to the province of Mpumalanga. It is unfortunate that the severe flooding disasters of the recent past has dealt our flagship nature reserves and access networks a painful blow. This financial year, through our allocation to the Mpumalanga Tourism and Parks Agency, we are moving directly into aggressive rehabilitation mode. Our focus will squarely be on restoring access roads, repairing damaged perimeter fencing, and radically improving internal security systems at our high-volume attraction sites. Furthermore, We are actively unlocking public-private partnerships to breathe new life into the multi-million rand impact projects, including the long-awaited Blader River Canyon cable car and the God's Window Skywalk. These flagship assets will elevate tourist spend, lengthen stays, and directly incorporate local communities in the lucrative tourism value chain. With regards to stabilizing governance and the senior management leadership of the entity, I am pleased to report that the recruitment drive to appoint a new chief executive officer for MTPA is nearing its finalization, and not just stabilizing issues of governance, but as well as the leadership also in terms of us appointing boards that would take us forward as a province for the next 4 years. Honorable Deputy Speaker, in our quest to position Mpumalanga as the prime tourist destination of choice, MTPA has significantly strengthened the visibility of the place of the rising sun, both domestic and international markets, through participation in the strategic tourism marketing platforms such as the World Travel Africa, Meetings Africa, Africa's Travel Indaba, Tourism Month activations, and our G20 activities that we hosted as the province of Mpumalanga, led by our Honorable Premier. Our participation at the recent Africa's Travel Indaba was a success, I must say, given the level of engagements and agreements which are on the pipeline that would strengthen tourism stakeholders, or with our tourism strategic partners, of course. Amongst other engagements, we met with the Indian Consulate, the delegations from the Republic of Mozambique and the Kingdom of Eswatini, as well as neighboring provinces of Gauteng, Limpopo, KZN, with the objective of strengthening partnerships and promoting tourism collaboration. Indeed, also reviewing our agreement in terms of our triland so that we are impactful in terms of our interventions as agreed with the two countries together with the province. Whilst at the Indaba, we also convened a successful high-level Mpumalanga tourism investment dialogue with potential investors to engage on various investment opportunities Mpumalanga tourism has and can offer, Honorable Deputy Speaker. These efforts have been complemented by expanded marketing campaigns, strengthened tourism safety initiatives, and support to the local events and sports in tourism. Importantly, we have continued to support emerging tourism enterprises, particularly those owned by historically disadvantaged individuals and the youth, ensuring that tourism growth is inclusive and broad-based. Honorable Deputy Speaker, we are delighted that the transformation of the Boekslag potholes facilities in the tourist accommodation is nearing completion, while hospitality facilities across several reserves have been awarded star grading to improve quality standards. We have successfully appointed a consignee for the development of the Mtomeni camp in Mahushe Shongwe Nature Reserve. The appointment of the concessionaire is yet another clearest indication that we are committed to leverage private sector collaboration and investment. It is encouraging also, Honorable Deputy Speaker, to also highlight the refurbishment of the Swatini entrance gate, that it has been completed, thus improving access control, revenue collection, and visitor management. Likewise, the development of the Barberton-Makonjwa Mountains World Heritage Site remains our priority, and the engagements are ongoing to resolve the impasse that is there, together with our stakeholder issues, and unlock its full tourism and heritage potential. Evidently, the investments already made in the tourism sector are beginning to yield value through improved visitor experience and increased revenue generation, and we want to really appreciate the Honorable Premier for really calling for us to be deliberate and intentional in as far as appointing an interim board that would assist us to turn the corner. And we owe these stability and achievements to the interim board, which is led by Ubabe Mahlalela, the interim board chair. Around the department strengthening support for small business development, Honorable Deputy Speaker, honorable members, for us to change the economic landscape of the province for the better, we have continued to focus our energies on strengthening our support to micro, small and medium enterprises. Our economic development blueprint, the Mpumalanga Economic Growth and Development Path, thus remains a crucial document in this regard, as it propels us to intensify our support to MSMEs so that we eradicate poverty and create massive sustainable jobs. This sector is crucial as it is, in fact, the one that creates more jobs. Therefore, our department remains committed to strengthen support to our MSMEs as critical drivers for economic development, job creation, and inclusive growth. Accordingly, we have scaled up our support to MSMEs by providing equipment, tools of trade, and aftercare services to women and youth-owned businesses in the textile, automotive industry, and green economy, particularly the township and rural areas. We have also been able to support small enterprises, such as, of course, one was pushed by the portfolio committees that it should not end with car washes, hair salons, plaza shops, manufacturing businesses, but indeed we can expand and look into other interventions to support our small enterprises. Coupled with that, we have successfully onboarded 50 MSMEs onto the Take a Lot platform, Honorable Deputy Speaker. Our support for these small enterprises is not just a box tick exercise, but rather a clear testament that we are intentional in our resolve to reposition the township and rural economy as the central pillar of inclusive economic growth, employment creation, and spatial redress. In addition, as we continue to leverage and embrace a district development model by collaborating with our municipalities across the province to create awareness about the Spaza Shop Support Fund stimulus package as part of our unprecedented drive to support or provide support to our informal and township economy. Honorable Deputy Speaker, in our appreciation of the structural barriers that continue to limit the participation of youth and women entrepreneurs in the mainstream of our economy, our entity, the Mpumalanga Economic Growth Agency, is intensifying its interventions to ensure that these groups receive targeted and meaningful support. This includes expanding access to development finance, enterprise development programs, mentorship, and market opportunities that enable MSMEs to grow and become sustainable contributors to the provincial economy. We are placing special focus on youth and women-owned businesses, as these segments often face challenges such as limited collateral, access to networks, and business development resources. Through dedicated funding instruments, capacity building initiatives, and partnerships with both public and private sector stakeholders, MEGA seeks to remove these barriers and create a more enabling environment for our entrepreneurship. In addition, MEGA will continue to align its MSME support program with national transformation priorities, such as articulated by the Department of Trade, Industry and Competition and the Small Enterprise Development Agency, to ensure that provincial initiatives contribute meaningfully to broader economic transformation and empowerment objectives. Going forward, as part of our agenda of strengthening support for our MSMEs, we aim to stimulate innovation, local economic participation, and sustainable job creation, thereby contributing to a more inclusive and resilient provincial economy. Through its development finance mandate, MEGA will continue to offer accessible funding solutions, including loans and blended finance instruments aimed at enabling SMMEs to start, sustain, and expand their business operations. These financial interventions are designed to address the financing gaps often experienced by our small businesses, particularly those that may not easily access funding from traditional financial institutions. Honorable Deputy Speaker, the shortage of skilled youth and women remains a major concern for the department and the provincial government. This has created a situation where the lack of skills has become a constraint limiting our MSMEs' participation in the provincial economy. And to address this, the department will leverage on the incubation program as a strategic vehicle to equip MSMEs with both technical and business skills, thereby enabling their integration into the mainstream economy. Our focus areas also include stainless and carbon steel fabrication, which will benefit 20 young people, as well as wood and furniture manufacturing, which will train a further 30 young people. Honorable Deputy Speaker, honorable members, our industrial parks revitalization program is gaining momentum. I am particularly pleased that the fencing of the entire Enkandastra Industrial Park, as well as the refurbishment and commissioning of the wastewater treatment works, is completed or was completed in the first quarter of our 2025-2026 financial year. The perimeter fencing in both Kapokweni and Siyabusa industrial parks was also identified as our priority. To this end, MEGA has appointed a contractor to start fencing Industrial Cluster 1 of Kapokweni Industrial Park, and I am encouraged that the project is at a 90% completion, and it is expected to be completed, Honorable Deputy Speaker, by end of June 2026. I am further delighted that our program for revitalization small industrial parks has received a shot on the arm, Honorable Deputy Speaker, as MEGA has received the much needed cash injection of an additional amount of 15 million rands from the Department of Small Business Development to complete the refurbishment of the following small industrial parks within the current financial year. There is Kapokweni and Kanyamazane, small industrial parks in the city of Mbombela, Siyabuswa and Camille River or Rafir, small industrial parks in the Dr. J.S. Morocco local municipality, Verena, small industrial park in the Tembisile Hani local municipality, and the Dan Donald, small industrial park in the Chief Albert Lutuli municipality. Honorable Deputy Speaker, we need more investment to support economic growth of our province. And in our quest to achieve this, we managed to raise 238 billion rands in the investment pledges during the two-day investment and mining conference that took place in Middelburg in Steve Tshwete, led by the Honorable Premier of the province, and indeed appreciated by His Excellency, the President of the Republic, in as far as the potential that Mpumalanga is having in terms of attracting or making Mpumalanga an investment hub, because indeed investment is a key ingredient to grow an economy. Around the business regulation and governance, with regards to regulating and governing businesses' operations, the Mpumalanga Economic Regulator continues to do a sterling and flawless oversight of liquor and gambling industries of our province. The regulator remains one of our province's most vital financial contributor, optimizing provincial own revenue collections to ensure that we can fund critical social services. In this regard, the Mpumalanga Economic Regulator has successfully generated approximately 2 billion in revenue, meaning addition to the provincial PES, representing a significant increase from the previous year's 1.5 billion and demonstrating improved efficiency, compliance, and growth within the sectors. I thought, Deputy Speaker, they would, applaud for the agency for having done well in terms of revenue collection. Evidently, this growth reflects not only improved efficiency, but also the success of positioning Mpumalanga as a leader in gambling and liquor regulation, enabling our licenses to participate competitively in a broader national market. We, however, note with deep concern recent developments regarding the national tax proposals in the concurrent regulatory space, specifically relating to online bookmakers. Our analysis indicates that these measures could not skyrocket the effective burden on licensed operators to over 42.5% of the gross gambling revenue operating cost. Accordingly, we firmly concur with the view that such national duplication risk, overcrowding our provincial collections, and severely weakening our capacity to fund local socio-economic programs. We thus commit to continue engaging our national counterparts to vigorously defend our provincial fiscal base. Honorable Premier, through you, Deputy Speaker. Deputy Speaker, modern economies and societies need effective regulations to support growth, investment, innovation, market openness, and upholding of the rule of law. To realize this, the department continues to work with municipalities and key stakeholders to enforce business compliance with relevant business regulations and legislations. During the previous financial year, we hosted a number of business licensing workshops across key local municipalities to ensure proper coordination and support for the development of the informal sector. These innovations are not just isolated engagements, but part of the deliberate strategy to strengthen municipal capacity and ensure effective implementation of business licensing frameworks. As a result, 10 municipalities across the 3 districts were capacitated and were also able to train also on their own 367 officials and stakeholders. What is encouraging is that most participating municipalities have fully operational and enforceable bylaws, while others are actively reviewing and strengthening their regulatory frameworks. Municipalities were also guided to enforce regulations in a manner that avoids unnecessary red tapes while promoting the economic participation. We have also intensified joint inspections with law enforcement agencies to ensure compliance with business legislations. This has resulted in 66 business inspections across the province, resulting in quite a number of shops being closed due to non-compliance. This ranged from operating without valid licensing and failure to meet health and safety standards. In terms of safeguarding the rights of citizens, consumer protection remains central to our mandate of ensuring fair, safe, and transparent market practices. In this regard, during the 2025-2026 financial year, a total of 159 consumer cases were received. Of these cases, 128 cases were successfully resolved, Honorable Deputy Speaker, reflecting a strong resolution rate and effective dispute management. This has resulted in the recovery of 808,484.88 cents on behalf of consumers. Deputy Speaker, the Mpumalanga Economic Regulator continues to play a critical role in ensuring that our liquor and gambling sectors contribute meaningfully to the economic growth while protecting our communities from social harms. During the previous financial year, MER intensified compliance and enforcement across the province, working together with law enforcement and key stakeholders. The entity conducted more than 6.8 liquor license inspections, with the majority of establishments found to be compliant. Where there are violations, decisive action was taken, including closures, suspensions, sending a clear message that non-compliance will not be tolerated. We have also taken firm action against the illegal gambling activities, removing harmful and unregulated operations from our communities. This work is critical in protecting vulnerable groups, particularly our young people. As a responsible government, through initiatives like the Miss Mpumalanga pageant, we have and will aggressively continue to educate our youth about the deep dangers of irresponsible gambling and substance abuse. The MER is also prioritizing the commissioning of a feasibility study for a proposed 4th casino in the province. During the previous financial year, we said we were going to do it, but we are, however, announcing that by end of July, we shall have completed the study, and we now have a know-how as to, probably, Honorable Premier, through you, Deputy Speaker, where it would be feasible for us to really have that fourth casino and attract investors to assist us to put up that infrastructure. Around our budget allocation per program, Honorable Deputy Speaker, the planned targets we have just tabled require accompanying funding for them to be realized. In this regard, the 6 programs for the department are proposed to be funded as follows. Program 1, administration will receive an amount of 146,928,000 rands to enable effective operational support to the programs of the department and its entities. Integrated Program 2, which is on integrated economic development, it will receive 358,585,000 rands. Included in this amount is 281,598,000 rands to fund the requirements of MEGA and 3,138,000 rands for the Mpumalanga Youth Tourism Fund. Program 3, which is around your trade and sector development, will receive an amount of 135,545,000 rands. Included in this amount is 80,439,000 rands for the Nkomasi SCZ, 2,307,000 rands for the Mpumalanga Stainless Steel Initiative, as well as 743,000 rands for the FinTech and 21 million for the Mpumalanga Green Cluster Agency. On Program 4, Business Regulation and Governance will receive 165,017,000 rands, which include 136,728,000 rands to fund the requirements of MER. On Program 5, Economic Planning, we will receive 25,564,000 rands. And lastly, Program 6, which is around tourism, will be allocated 574,996,000 rands, which includes the 563,560,000 rands to fund the requirements of MTPA. In total, to be transferred by the department to its public entities, we are transferring or will be transferring 981,886,000 rands. Honorable Speaker, the Honorable Deputy Speaker, this policy and budget speech is not just an exercise in optimism. It is a meticulously calculated roadmap engineered for economic execution. We have aligned every single rand for structural transformation, job creation, and spatial equality. As the executive authority of the Department of Economic Development and Tourism, I now request the House to consider and appropriate the total allocation of 1,406,635,000 rands to fund the requirements of the department, which is your vote 6, for the financial year end of March 2027. Honorable Deputy Speaker, allow me to extend my profound gratitude to my political home, the African National Congress, the liberation movement of Imbokodo, Mamuini Matikizela Mandela, for entrusting us with the task of implementing the electoral mandate during the term of the 7th administration. I also wish to extend my deepest gratitude to the Honorable Premier, Mr. Mandla Ndlovu, for his unyielding strategic leadership, the members of the Portfolio Committee for keeping our pencils sharp through these rigorous oversight, and to the tireless staff of the department and our entities. To the people of Mpumalanga, the place of the rising sun. The sun is rising once more. We are reconstructing, we are recovering, we are opening the doors for economic participation wide enough for everyone to walk through. Madam Speaker, let me conclude by also extending my gratitude to my family for allowing me to continue to serve our people, to all our social partners, including organized labor, the private sector, and the people of our province for partnering with us in the noble crusade towards inclusive economic growth. Indeed, Mpumalanga is a province that works for all. Thank you very much, Deputy Speaker.
Thank you very much, Honorable Seidel, for well-delivered policy budget speech. I now invite the Secretary to read the 10th order of the day.
Order number 10, consideration of a report of the Portfolio Committee on Economic Development and Tourism, vote 6, Department of Economic Development and Tourism.
I now call upon the chairperson of the Portfolio Committee on Economic Development and Tourism, vote 6, Department of Economic Development, Tourism, Honorable L.A. Mbuyane, to table the report.
No. Thank you very much. Honorable Deputy Speaker. Greetings to you and the Honorable House. On behalf of the Portfolio Committee for Economic Development and Tourism, I rise to request the August House for considerations and adoption of the report. Thank you very much.
Thank you very much. I'm informed that there is no debate on this report. I now put the question before the House whether we agree to adopt the report presented by Honorable Mbuyane.
Agreed.
So agreed. Honorable members, that concludes the business of the day. Before that, honorable members, I have a special announcement. With the powers bestowed upon me by the judiciary arm, the JP, during our sworn-in as honorable members on the 7th administrative. As an executive authority, honorable members of the Mpumalanga Provincial Legislature, in terms of Rule 3.1, the Speaker may come up with a rule consistent with the Constitution in respect of an eventuality for which rules do not provide. It is with the deepest sorrow and respect that I extend my heartfelt condolences to the family, loved ones, and the people of Ndebele Nation, people of Mpumalanga, South Africa, and international community, following the passing of His Majesty, King Makosonga II. His Majesty was a symbol of heritage, identity, and leadership. We honor his contribution and recognize the important role traditional leaders in presence of our culture and strengthening our community. The province of Mpumalanga continue to respect and uphold the dignity of our traditional leaders. Our condolences goes to the entire traditional leadership and its disciples across the SADC region and the world. Our condolences goes to the entire Contralesa leadership and its president, Kgoshi Mokoena, and all the Amandebele Nation for the loss. Uwile umthi omkhulu. Lala upumule ndlovu enduna masokasokile ngwenyama. May the family find, and the family and the children of His Majesty lift up their hands to God, because all our help come from Him. May his soul rest in peace. I hope honorable members will use Rule 90.1 or subsection 1 rather, and request the Honorable Speaker to place this important matter of public importance on the order paper for debate, neither a discussion, for our next sitting through a formal motion in respect of the contribution that His Majesty have played in our role and in our province and in our country. I request you all remain standing in your places.
Before that,
as
Speaker,
the procession left.
we agree with your
Thank
motion.
You.
Yes.
Thank you. Thank you.
Honorable Premier must not get any present because he didn't give us present.
Okay.
His office didn't give us present. Other department gave us present. So he must not get.
Wait. Honorable members, the House is adjourned until tomorrow, Friday the 12th, 2026, 9 o'clock. We're all expected back here in this very chamber. I thank you.
Honorable Manzino, sniya ma into tokubeka amaphilisi uve bathi siyagula.